central cord syndrome. And soon we'll be over this laundry list of syndromes as well. But central cord has been studied ad nauseum in the field of neurosurgery. It's something that's fascinating, both on its the diagnosis and the treatment and when to operate and when's appropriate for these patients. It's defined as an incomplete injury. The upper extremities are more affected than the legs classically, although say if someone falls and trips over a curb, they can be completely quadriplegic initially, and then they'll recover some function in their legs, and then the hands are often last. Tend to have a more favorable recovery, of course, than like a classic fracture dislocation, because it's often a chronic thing that's irritated by another jolt. And essentially, by definition, it's without fracture or dislocation. And so it's an acute bending or hyperextension or flexion of the neck in the context that the spinal cord's already been compressed at that point. And it gets its name by the fact that ischemia to the central part of the cord is classically thought to catch the fibers that are organized somatotopically from cervical, thoracic, and lumbar from the center out. And so the hands and the upper extremities tended to be hit earlier. That doesn't quite hold. This is the classic textbook answer. Turns out that our upper cervical spinal cord has a ton of fibers devoted to these two things. And it's really one of the things that makes human beings special. And so when you have any injury in the cervical cord, you're going to statistically knock out more of these fibers that aren't necessarily nicely and neatly arranged in these little somatotopic areas. They're actually a little more diffuse than that. And so that's the current thinking, is that statistically, you're just knocking out more of these fibers than you are the legs. So kind of a unique, more modern take on that. Anterior cord syndrome knocks out the motor, complete motor paralysis, all shown in red here. The anterior points, the loss of pain and temperature, preserved position and vibration that are in the back, associated with a flexion injury, which makes sense, and has a pretty poor prognosis, just given the fact of where it is in the injury.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.